I think one of the first things that we realized in my building of chronology was that giving, as I mentioned earlier, of that instant feedback to get people tracking their health, for that to connect with them. And so once we realized the power of the network, of having a social network where patients can also track their health, is that you can connect those two. So when someone is doing poorly, their health is doing poorly, as I showed up there, the system can even tell them who else is kind of in the same boat with them, right? But on top of that, their friends and other patients in their same location can comment on their health. And this is funny because I've demoed the site a number of times and have just shown people, here's how the health slider works. You can slide this to the left so your health's not so good. And then by the time I've come home from doing that demo, I've got like an inbox full of people like, I'm so sorry your health has dropped. And I have to explain to them that it was totally a demo. But, and I've even just using the interface over SMS with chronology right now, like there's been moments where, I'm in extreme gut pain and I'm doing really poorly and I'll update my health on there. And even using the system that I've designed myself, and I should know exactly how it responds, I've still experienced that burst of like emotional gratification and warmth of like, there's some concern and there's someone else out there that is in my same shoes. And that's been a huge design win for us. But also just the simplicity of, there are a number of complex variables that you could track with your health with Crohn's and colitis. And that could go from just, probably 6 or 7 different symptoms around fatigue and nausea and gut aches. Or you could create a more simple social shareable health status, which is really expression of your health. Because ultimately, what people want to do in a social environment is their health is an expression of how they're feeling. And if they can just, instead of having the system take 6 different symptoms, crunch them and say, your health is 100% or your health is 50%, which is actually kind of insulting when it's not, right? And it's that same sort of paternalistic healthcare system that we're in currently. But if you can then turn it on its head and say, why don't you just tell us how you're feeling and we can express that to your friends so that they can understand what you're going through. Again, that's been a huge sort of design accomplishment that I feel like has worked really well for us.
Well, I mean, that's a really good question because in the case of diabetes, I mean, we're talking about sort of a life sentence. I mean, when you're diagnosed, they sit you down and say, guess what? You have this illness, you're going to have it for the rest of your life. Every day of your life, you're going to have to count the carbs of every morsel that goes into your mouth. You need to exercise this much a day, you got to take this pill, here's how to upload the insulin into your product, you're going to have to do this, you change it every couple days. That's a lot of stuff that you need to do forever and ever and ever. And how do you motivate people to keep being excited about doing that right and doing, and being the best at it? Really tough. So, I mean, I think the community aspect, having cheerleaders, having kind of, camaraderie is a huge one. But I also was, at our summit, I sat at the table with the guy from Ioigo, which is this health games developer, and we had this big discussion about how would you create something for diabetes. And I said, it can't be linear. It cannot be this thing where you achieve a certain level, everyone likes a sense of mastery, so yes, a game where you achieve something and you get a badge or whatever, that's great. But then you achieve that and then great, I still have the rest of my life to deal with this illness. Like, how are you going to keep me engaged? So we kind of sketched out on a napkin, the idea for this sort of a swirl, like a circular game that keeps going around where you cycle through different sort of like refresher courses about the different aspects of living with diabetes, like a refresher on carb counting and food choices, a refresher on portion sizes, a refresher on trying different types of exercise, a refresher on tweaking your insulin dosing so that you're optimizing it. And those are things you would go through, you would complete that module, and then you'd get some kind of reward, and then you'd go on, and at some point you're going to have to go back through that, because you're going to have to deal with that same thing the rest of your life, and you need a refresher, and maybe you'll learn something new each time you cycle through that portion of the program. So that was kind of my vision for, how we can design something that actually keeps people engaged over time.
Habit change is hard, and incenting healthy behaviors is always a challenge. I think the way that we've tackled it, at least initially from a hardware perspective, is in reducing barriers. So I loved Amy's Pfizer example with the inhaled insulin. It's exactly what we're trying to avoid, right? We want we wanted, for us, it's about having a device that fits your lifestyle. You put it on, you forget about it. It's water resistant. You can sweat into it. You can work out. It's something that you're not ashamed to wear to work or wear with a suit. So just that first step of actually getting people to wear it and start recording the data, you know, there's no next step. There's no health behavior change for us if people aren't wearing our device to begin with. So I'd say from an industrial design and hardware perspective, that's our first goal is reduce barriers to use, and if you're lucky, make something that people want to wear. So make something that becomes a symbol, that a physical symbol that you're wearing and that you're showing off to other people. Look, I'm dedicated to a healthy lifestyle.